Right, you're still watching Breakfast Central today, Monday. Let's go straight in terms of what they call the COVID-19 updates. And we've got Joe Hanson, who's not thrown away from us any time soon. Well, morning to you, Joe. Welcome back once again. Although you're not on the yellow count, but you're there. But Joe, it's interesting that Tanzania are talking about vaccinating people in the second phase of inoculation in the country.
That's right. And they're also looking at making it very big. Their targets are indeed something feasible. But Tanzanian authorities, by the way, says that between 80,000 and 100,000 people will be vaccinated daily against COVID-19 during the second phase of the inoculation campaign. A statement by Abel Makubi from the Ministry of Health, Community Development, Gender, Elderly and Children revealed the acceleration of the vaccination in a meeting with regional medical officers and COVID-19 vaccination coordinators in the capital, Dodoma. According to Makubi, the second phase of the vaccination campaign will mainly focus on rural communities and will go in tandem with raising awareness at community levels on precaution measures issued by health authorities against the pandemic. So it's good news to know that they are actually working very hard. And like we rightly said on this program last week, that ever since she took to power, she has ensured that everything is working out very smoothly. But let's leave Tanzania now. Let's go straight to Rwanda, where Rwanda has received 300,000 doses of Sinopharm COVID-19 vaccine donated by the Chinese government. The second batch donated by China so far. The country's head of Disease Prevention and Control Department, Albert Tuyishime, described the dose as a huge step in the fight against the COVID-19 pandemic. Now, since the outbreak of COVID-19 pandemic, Rwanda has been working with the Chinese government in terms of testing kits, treatment and vaccination deployment. If you recall, in August, China donated the first batch of 200,000 doses of Sinopharm vaccine that have been used to vaccinate Rwandans, contributing to the Rwandan government's target of vaccinating 60% of its population to protect them against the virus. So, it's good news for Rwanda, and they're looking forward to also receive more, which actually shows that they are pressing forward to ensure that all citizens are indeed inoculated. But let me bring you quickly up to speed with the COVID-19 Africa Index. No doubt, according to the Africa Center for Disease Control, the region has recorded over 8.6 million confirmed cases with over 220,000 deaths, while the number of recoveries is pegged at over 7.95 million, which we're hoping that it will continue to increase. When we say increase, we mean the number of recoveries, while we also hope that the number of confirmed cases will drop. Hopefully, it drops from 8 million plus all the way down to about 2 million. And that's what Africa is actually gunning for. So that's all I have for you guys here on COVID-19 updates, Elisa and Oluchi.
All right, Joe, thank you very much for that update. So we hear that the vaccination drive perhaps maybe increasing in different parts of Africa. And other countries, Oluchi, are even opening up. I even heard this one in the US, if you're double vaccinated, perhaps like Joe is,
will be allowed into the country. And even countries like Australia as well that have separated loved ones who have actually left the country. Now, if you're fully vaccinated, you do not need to isolate yourself anymore. You're free to go home.
Joe, I suppose even, I mean, when they say people who are double vaccinated, even countries like Nigeria and Africa, South Africa, right?
That's right, that's right. And it's good news to also know that the United States have come out to say this, because we recall that a lot of people have complained bitterly that even though you have been vaccinated, you have to go there. They tell you, oh, we don't trust what you came with, but you know what, quarantine and so on and so forth. So it's been back and forth. We like the fact that the countries are stating these things clearly, making it clear, telling people, listen, if you've done this, this is what you get, and that's what we expect from other countries as well.
All right, so let's open up after quite how many months, more than 20 months of pandemic scenarios. Thanks very much once again, Joe Hanson, for the latest when it comes to COVID-19 around Africa.
Thanks for having me. Breakfast Central, let's go straight to sports. Tolu Show today is on standby. What's happening, Tolu?